Welcome to the Dr. Mudgil podcast. I couldn't be more excited to have Dr. Gary Linkov here, who is he does a lot of things. He's a facial plastic surgeon, I would say a hair transplant expert, and we'll get into all of that stuff. You schlepped out here from New York City to join us this morning, so I couldn't be more excited, man. Thank you so much for joining us.
Thanks, Dr. Mudgil. Thanks so much for having me. So excited to be here with you today.
Hey, man. So as you know, I don't know if you listen to the podcast, I'm sure you probably heard a couple of the episodes. One of the underlying themes is basically what success means to an individual. And as I always say in all the podcasts, the definition is always a little bit different, but ultimately it all boils down to the same thing. But it's always great to hear someone's own unique perspective on what success is. And I'll kind of drop this on you when you showed up this morning. I usually give my guests a day or two to think about it, but you're a smart guy, and I'm sure you've kind of thought about this. So just please fill us in on that, and then we'll take it from there, man.
Yeah, I mean, to me, success is just getting to do what you really love, every day. And so that's really what it boils down to for me. And also, I mean, I think it's easier to do that if you're working for yourself. So that definitely factored into my decision to start a practice pretty early after my training was over. But that's really what it is. I mean, I don't think that you can put a dollar amount on success. I think it's just, being able to go to work and really love what you're doing and be somewhat in control of how, you plan out your future. So that to me is success.
I think that sums it up really well, man. And you're someone, just reading through your bio on your website, you're someone who's achieved a great degree of success, I think, at every level. You must have excelled in high school because you went to an Ivy League college. You excelled in college because you went to an Ivy League medical school. We both kind of shared the background as our parents were immigrants, and you were actually born in the Ukraine.
Right.
I was born here, but your formative years were basically here. You came when you were 2 or 3 years old. Yeah. How do you think that sort of factors in? It's like for me personally, the hustle of my mother really put a fire under my ass, and wanted to make me do my best. Really inspired me to hustle. I imagine there's some element of that in your upbringing, but maybe you could just drop a few minutes on that.
Yeah, I mean, for sure. I think the drive to work hard comes from different kind of aspects and different kind of corners. So definitely I have constantly my parents' voices in my ear saying, like, you have to achieve, you have to work hard. Also, they've never really been able to achieve like independence and always kind of worked for large organizations. So they've told me, like, try to work for yourself. So of course, growing up with that in mind influenced what I do today. But also, I think it's the love for what I do, like, medicine and healthcare, trying to improve people's lives. It definitely inspires me to constantly read and do more and try to improve my skills. Because at the end of the day, it's you have another human being in front of you who's coming to you for advice, and I just feel like I need to do everything possible to come fully equipped with the latest information and try to do my best for them every time. So definitely that also like inspires me to work really hard and continue to kind of achieve on a high level, because I think you can't half-fast it when you're taking care of other people. So those are some of the main drivers, and but for sure, like, being an immigrant myself, first generation, definitely seeing how hard my parents worked to even get here, and the drive to even say, like, hey, we're gonna drop everything that we have and start anew. We actually were refugees when we left Ukraine because they didn't let us keep our passports there. So you're kind of leaving without the knowledge that you're going to have success in the new place. So, I think that factored in also to my decision to kind of, start the practice early, because I figured, like, let me just take the chance, but I had that courage, I think, because of what my parents did to get us here.
It's interesting. My mom was like the exact opposite. So she was a VA physician, it's very, I mean, she was a physician, but it's not like, the big baller physicians that were like, really had successful practices in the 80s and 90s, like when medicine was having sort of its golden era. She was a government doctor, and for her, she actually kind of discouraged my brother and I from starting her own practices because she thought it was too risky. She's the comfort of working for a larger organization for her was like, okay, you know what, it's safe. You know what you're going to make. You can plan accordingly. it's interesting that your parents had the exact opposite take. They were working for large organizations, and they basically said, "Listen, you got to work for yourself," because there's so much risk associated with that. I know when I started my own practice, it was, I was shitting in my pants. I was like over $1 million in debt, and I don't come from, I come from very humble upbringings. I didn't have anyone bankrolling this for me. So, I got what my mom was saying when I was living through it, but I'm glad that I did it. My wife really encouraged me and kind of pushed me to do it. But it's amazing that your parents, had this entrepreneurial mindset,
Yeah, I mean, that is really interesting. You can face the same, experiences and challenges, but then, have a different interpretation on it. So I think this kind of brings up another like great point where I think we're told many times, especially for entrepreneurs, that you have to go all in. You watch Shark Tank, and that's what they frequently say. But when you read certain books and you actually hear about people's like real stories, it's rare that people truly go all in. There's always, I think, some hedging. So it's, you also brought up the VA. So I'm at the Brooklyn VA 2 days a week because as I start my own practice, it takes time to build. And
which is where she worked, by the way.
Yeah, at the Brook. Oh, that's really cool. So my form of hedging is to say, well, I'm going to go to the VA. I'm going to get a steady salary there, but also continue to build my practice or to follow my passion. And that's, I think probably one of the better ways to do it, because if you drop everything and yes, it's very time consuming and all of that, but I'd rather, work, the Sunday and part of my Saturday and continuing to kind of build while I also have some safety net there. So that's, probably an important point to bring up for any kind of entrepreneurial endeavor, that I think it's actually rare. There was a book I read, I'm trying to remember the name. It was Adam Grant, is a UPenn author. I'm trying to remember the name of the actual book. I'm blanking right now, but yeah. Originals is the name of the book. It was a very good read, and he brings up examples of how people really didn't always quit their day job, and often, like Bill Gates, was working for a company when he came up with the software. And was already starting to kind of hustle on the side while he continued to have his day job. And that's a pretty common story. So, yeah. So, I mean, I think sometimes it seems from afar or in hindsight that, oh my gosh, this person is such a big risk taker. And then there's always like some hedging going on.
Yeah, that's a very good point, because I had a big hedge going too. I was actually, I'm a dermatologist and dermatopathologist. I was actually reading slides for a group, and which was, I basically assumed someone's full-time job to do that. It was a huge volume practice, but that's what you're saying. It's like I was working 7 days a week because I was building my practice, reading the slides on the side. But that's kind of like, you're right. There's always a hedge, but there's always a hustle too, because everyone's not going to work 7 days a week.
Exactly.
Like you are right now.
Yeah.
So something to be said for that. Obviously you have to make an income. You have a family. You don't have kids yet, right?
No, we have one on the way. Early August.
That's awesome.
Yeah, thank you.
So it's it's real. Like you have to make money because you're living in New York City, and you have a family.
Yeah,
that
absolutely
you have to contribute towards.
Absolutely.
And I felt that same pressure, which is why I was working sometimes I was working 3 jobs at the same time.
Yeah,
because you got to get paid to live in New York City.
Yeah, I mean, I think to start a business of any kind, you have to really enjoy it and be okay with. I mean, there's no such thing as like overtime. It's just constant work, especially in this era with, social media and everything being online. You never know when you're going to get that next message, or that little red icon will pop up on your Instagram, and it could be nothing, and it could be something really interesting that kind of continues to propel you forward. So I think it's, it just have to be okay with that sort of all enveloping process, and some people aren't. They want that those steady hours, and then to just. My wife is like that. I mean, she's a physician, very smart, very good at what she does, but she wants things to just end at a certain time and not be bothered. So she works for the Manhattan VA actually full time, and when she's done with the day, I mean, there are no phone calls. There's no one coming to her with questions work related, and that's what she likes. When she's at work, she's super focused, takes great care of the veterans, but when she's done, she's done. For me, I always feel like there's something missing almost, if like why should I be done if I'm doing what I enjoy? So sometimes for sure things can, go to the other extreme where it gets a little overwhelming, and, you're staying up late thinking about your next step or something that happened where, you have to, the full burden is on you. So if something good happens, great. You're like, I did this, I'm awesome. Something bad happens, it's kind of your butt on the line. And, so I think you have to be okay with that sort of nonstop work environment.
Yeah, man, that's very well said. I do think my wife is a dentist, and she has her own practice here, but she works for other offices as well. But I do think for a relationship, especially when you have a family, like which you're about to find out, it kind of is important to have some balance within the relationship. So
Right.
It's hard if both parties are balls to the wall and hustling nonstop, because I think the family could potentially suffer under those circumstances. So for myself, I have 3 kids, and the balance between me like always on the hustle and my wife also hustling hard, but having the sort of dedicated time where she can focus on what the family needs has been so invaluable. I mean, that's not to say that I feel like her hustle is greater than my hustle, because there's so many moving parts with the kids and work, and I don't know how she does it all. But women are also, I think, more sophisticated than guys when it comes to sort of multitasking and managing all those sorts of things.
Yeah, and I mean, I think having someone at home who really supports the efforts, of that maybe one individual who's trying to really drive things forward, I think is can't be understated. I mean, it's so important. I mean, I kind of feed off of a lot of her support and energy towards just, encouraging me to continue going. And also whenever I have like a real question or issue, she's the first one I ask for advice from. So she doesn't officially like work with me, but I mean, essentially she gives me more advice than anyone else. But also, I think another way to look at it, like, for example, I also considered taking out a bigger loan to do more at the start of my practice. And she basically said, you're not doing that. And, it's kind of hard to overrule her, because you have to kind of compromise and make things work in the relationship. And she just felt that, with my student loans and other things that were happening with, the baby coming, that this just wouldn't be smart, and that I could still do it without taking out that more major loan. So, I said, okay, well, let me try it. So I think, just an extra challenge, if you will. But in a way, I think you have to, again, if you're going to go to the person, respect them for certain types of advice, you have to be open to maybe doing it in a slightly different variety than how you initially envisioned. So yeah, I think having someone at home who you truly trust and who can help you in all the different aspects of a business, I think is invaluable.
Yeah, man. I same here, man. I bounce everything off my wife, and she's given me tons of great advice. And I think set appropriate limits as well. Just like your wife's like, hey, it's probably not a great idea. Yeah, I would say my wife is definitely more fiscally conservative with stuff, and it's you kind of need that in your ear a little bit too,
Right.
Because there's always the next laser you could get, or the next device that you can get. These are like hundreds of thousands of dollars, like each one of these devices. And everyone else seems to be getting one. You're like, oh shit, I need one for my office too.
Yeah.
But there's the reality of running a business as well, right? So yeah, that's I have a boss.
And the marketing expenses it amazes me how much some people pay. Like I'm starting to finally figure out what some of the competitors are paying for marketing, and it's just astounding, and I just think like, of course they're getting more leads because they're paying for them. And sure, it helps to have been in practice for many more years, but still there's also, something to be said for just a budget that's set aside for, especially like online, targeting of patients. And that can be very tough to compete against.
Yeah, it's interesting. I never, like early on, I never really did anything. I was on ZocDoc. That was like the one thing that helped me really grow my practice in the city. But until I started like really talking to other doctors and like learning like, wow, there are a significant portion of the revenue that the practice is generating is allocated towards digital marketing or, like search engine optimization, whatever it is.
Right.
I was I was like, wow, I probably do need to maybe do some more of that, you know? So
Yeah.
in the last couple of years, or maybe the last year, I should say, I have been allocating more resources towards that. It's hard to know what the benefit is because I feel like everything takes it's like a year cycle, basically. So you basically make this huge investment and you know, it's a gamble, right?
Yeah.
But you know, if it works, then you allocate more resources to that. But if it doesn't, then you know, you allocate those resources to something else. But that's business, man, right? And you know, when you're a doctor, no one really learns about business unless you actually go to business school, and you know, and that's a different type of business, I think, as well. But when you have a small business and you're running a small business, your biggest resource are other people who are running a small business like yours, you know? So for me, I found talking to other doctors who are in private practice, which are few, and there's not a lot of doctors in private practice anymore because of all the consolidation and stuff that's happening in medicine.
Yeah.
And there's even fewer solo practitioners, you know? I mean, I can name on one hand, like the solo practitioners that I know that are in solo private practice. Right. And they're an incredible resource for me because, you know, we bounce ideas off each other. Hey, did this work for you? And it's also important there's not a lot of there's not a lot of competitive energy when it comes to, like, you know, when I'm talking to my other friends who are dermatologists in solo practice. Yeah. It is a very collegial environment because I know these folks for years and we're friends. Yeah. But it's cool to me how open we all are with each other because, you know, I mean, first of all, we're in New York City. There's a gajillion people that live there. Yeah. Right. But, you know, we truly want to see each other succeed, which is really, that's great. It's a beautiful thing. Yeah. It's pretty cool.
I found a small group like that fairly recently. There's like the Facial Plastic Surgery Society in New York. And recently I just met like 3 other fairly young, you know, plastic surgeons specifically for the face. And we went out to dinner and realized that we each have like some subspecialty within the field that we would like to promote in our practices. And it was pretty amazing because it's not like we planned to have something different, you know, each person, but everyone really had like their own little niche. So it's amazing. You think like we're already so subspecialized, and yet there's still something that someone likes to do more of or has more experience with. So you try to support each other that way. And one of the people, actually, I pulled him into the space where I'm currently practicing. And so he's like a revision rhinoplasty subspecialist. And so in a way, maybe it kind of creates a little competition for me, but he also, just based on his training, has a ton of experience in just that. So when I had a recent case of kind of a more challenging nose, I went to him to just kind of confirm, like, is this what you would do? So it also becomes another great resource. It depends kind of how you look at it. I think some people get, nervous about talking to their colleagues, but I see it as like a huge plus as well. And it's really important to foster those relationships going forward. I think there are very few people who do good work, like truly good work, who care about what they do, who aren't just in it for the money. And when I hear, even if I don't know the person, but I just hear that, oh, this person's really good, and I see their results, and like I get excited almost, you know, that there's someone out there, you know, who cares and is doing great work. Right. And so I don't think there's ever like, you know, people told me like, why are you going into Manhattan? It's such a saturated market. I didn't really ever see it that way because I always felt that there was room for someone who would do good work, you know, and I think that's the case really anywhere you go. Maybe someplace that's more isolated where you're the only doc, you know, or in your specialty for, you know, hundreds of miles. Sure, even if you're not that good, you can still prosper. And there are plenty of people in Manhattan who, you know, really kind of have subpar results or just are maybe in it for the wrong reasons. And they still, some of them have like flourishing practices. So yeah, I think there's room for good people. And I think that those same people should really kind of link up and, you know, create a great environment for everyone.
Hey man, whether in New York or anywhere else, in New York there are a lot of plastic surgeons and dermatologists in New York. Yeah. But the cream always rises to the top, man. You know, I mean, it's just the way it works. Like, you know, your work will speak for itself. The way you treat your patients speaks for itself. And word of mouth is the single biggest factor for me that I found in the growth of my practice. You know, it's the golden rule. You know, just treat people with respect, the way you treat family, a loved one. Deliver the kind of care that you would expect a family or a loved one to receive. Right. And it's a self-perpetuating thing, man. You know, I want to go back to two things I want to ask you. One is, are you an artist also? Because I saw in your profile that you went to the Medici Institute, you know, which is, or I forget the exact name of it, but something Medici, which are obviously like a huge art family historically. Right. Yes. So what was that all about? I know that was between college and med school, right?
Yeah. I dabbled in art since I was a little kid. My dad's a classical guitarist. Now he does a lot of computer work, but his formal training is in classical guitar, and he taught at a conservatory in Ukraine, in Kiev. And so he, he's just a really good artist in many ways. He's a creative guy, not just a good musician, but he's also a good like fine arts kind of person. And so I get a lot of like my creativity, if you will, from him. So I tried several instruments. It wasn't my thing, clarinet, guitar. He tried to teach me, just didn't come naturally, and I just didn't have that drive to keep going with that. But art and drawing and painting, I really enjoyed from a young age. So my parents set me up even for like, it was really nerdy, but even just some art camps. There was one USDAN, which I don't know if it even exists out in like Suffolk, Long Island, but it was called USDAN. It was like kind of an artsy sort of summer camp. So I'd go to that. I'd go to Hofstra for just some art classes for young people.
So this is for like drawing,
painting?
Yeah,
drawing, painting, some sculpture, but mostly a lot of acrylic painting. And so I just kind of did that when I was a kid, little art shows and stuff. Nothing truly professional, but I enjoyed it. My parents supported that, and so that kept going. And then in college, I took some more formal classes. Again, it was not my major, but it was just something to do, elective, that I really liked. So then between undergrad and med school, I had a chance to go for 6 weeks to Florence, lived in Florence, Italy, and took this, it was actually a sketching class. So every day I went to a different museum. There's so many museums there, and even to like neighboring towns, and just sketched whatever I saw, and we had instruction and all that. And
so would you sketch? You come back to like a clinic type setting, and they'd go over like
exactly. They had like a studio, and then we would just go like on site, do the sketching for there were different themes for like each week, and then we'd come back to the studio, get our instruction, and then kind of go back out into the field.
Is it in Italian?
It was no. It was this school, this program there has many different classes. So I was living in this like 4-bedroom apartment with guys who were doing all types of other different classes. So one guy was taking like a mafia class, like another one was like into photography. So everyone had like their own thing, and we still went out and had a good time in Italy. But it was great to improve my kind of art skills, and just kind of enjoy the culture there.
Is that something you're still involved in, or do you still like sketch and
I don't have that much time anymore. In med school, I did some of that, just kind of hanging out in my dorm room. I would do some, but honestly, like once residency started, and now I don't have the space for it, but also just like the time to sit down. But I definitely feel like it helps. anytime you have to design an incision on the face, like there's a lot of that kind of artistic stuff that factors in.
So like every plastic surgeon I know is an artist. A lot of them are actually.
Yeah, I mean, it definitely helps. I think part of it is kind of inspiring my interest in the field, but also it's helpful for the actual procedures, because if you don't have that kind of artistic eye, it's very hard to decide like how are you going to close a wound on the face, right. Or how can you optimize some surgical procedure that you read about or saw someone else do. Those constant like iterations are helpful to come at it with like an artistic background. So for sure. So one day it'd be nice to build out some kind of a studio where I can do some clay molding and all this kind of stuff. But for now, I'm just I go to the museums, and enjoy looking at it. Yeah.
The other thing which I think is unique with your practice is a lot of plastic surgeons, like a focus for them isn't hair transplants. It's either like a total unique subspecialty that all people do, or a lot of dermatologists do hair transplantation, or general surgeons. Like folks just get into that, but that's the sole focus of their practice. You're a hair transplant expert. You did a lot of training in hair transplants, but not just hair transplants. You do like a lot of wild stuff, like eyebrow transplants and even wilder stuff than that. One is, how do you get interested in that, and how do you incorporate all that into your practice with all the other surgical procedures that you do?
Yeah, it's interesting. People ask me like, when did you know you wanted to be a doctor? That started when I was like really young. And I never necessarily wanted to do head and neck surgery and facial plastics, but I knew I wanted to do something in medicine when I was really young. Hair, I got into a little bit serendipitously. I mean, it wasn't really all very thought out and, I'm going to be a hair transplant surgeon. The interest started, I would say, towards the end of residency. We had these exams, the in-service tests. So before you take like your board exam every year in residency, you have these practice tests. And I was finding that towards the last few years, there were just a lot of these hair questions on our tests for whatever reason. And I was like getting a lot of them wrong. And I'm like, how do they expect us to answer this stuff? Like I've never seen a hair transplant. No one I trained with like does this kind of stuff. So I read a little bit about it, and that helped, a bit on the exams. I gave a talk in my last year of residency to the residents about like hair transplantation. But again, I'd never seen it. I just took a chapter and just made it into a presentation. So then during fellowship, I was at WashU, and they didn't really give us much time off. They told me from the beginning, like, you're going to get 10 days, and that includes any conference that you go to and any exam that you have to take. And I had to take 2 sets of boards, and which were like 2 days each. So I'm like, wow, like, I don't have that much time. But they told me like, oh, there are a couple of conferences, and one of them and courses that you can take. And one of them is this hair transplant course in Miami. So I'm like, look, this is just like a great way to kind of get out of town, go maybe learn a little bit more about hair, because it was going to be on my like final board exams, and just kind of see what it's all about. And it was with this person, this hair transplant surgeon who's very popular by the name of Jeffrey Epstein. His practice is in Coral Gables. And so I'm like, okay, let me go check it out. So I went there for 3 days. Normally he charges a lot of money for a course like this, and he has a lot of doctors who are looking to get into it. But for fellows, since he came through that same pathway, it's free. So if you're a fellow in facial plastics, he just comps you and you just go and hang out. So I did that for 3 days, and that's really when I started to like truly learn about like the art of it and the nuances that it takes. Because you read these books and chapters, and there's no way you can just start doing hair on a high level. I mean, yeah, you can buy a machine, you can hire technicians, and just kind of put it together, but you'll never truly understand like the underpinnings of it. And I don't think ever really get like great results and do things that aren't sort of your traditional just scalp replacement. So being at the course, sort of bonding with the staff that was there, getting to know Dr. Epstein, talking to him about sort of what my plans were after training. It actually was him who came to me and said, hey, we should keep in touch. And this was towards the beginning of my fellowship. Let's be in touch and we'll see where things go. But he tells me that he's in New York fairly often, once every month or every few months.
Just to hang out or working?
No, to work, yeah. Like he was renting space from someone and just doing transplants there, because he kind of draws from all over the world, and a lot of people just want to have it done in New York. So his prices were a little bit higher, but he was bringing his entire team, like 12, 14 people were flying up to New York every once in a while to do these cases. And he's originally from Long Island. So we just kind of had these things in common. So kept in touch for a while. I wasn't really hearing anything back, and I was making my plans for my return to New York City, and I didn't know if it would really actually work out. But then towards the end of a fellowship, he finally started to reply and said like, yeah, you know what, I think this could work. Why don't you come out and spend time with me? So I actually lived in his guest house.
That's cool, man.
And after my fellowship, I spent, a couple of weeks there in Miami, went to work with him every day.
What's his day like?
So it's very busy. I mean, he works long days, but now I think actually just in the last maybe year or so, he's now off basically 3 days a week he's off, and so he's just cutting back a little bit. But his days are start super early, like usually 6:30 is the first case, and he's there until about 7:30.
Do we take you like Starbucks on the way into work? And
yeah, no, we just he I think had like coffee at home, and then we just took his car in, and his office is maybe just like 5-10 minutes away from where he lives, which is super convenient. It's just a very kind of close-knit staff that he has. A lot of them are Cuban, and so they just have like this great connection, and extremely hard workers, and really are passionate about hair, which is great. And many of the techs have been with him for like 10-15 years, and that really I think is what makes the difference, because if you have traveling techs who just come and go,
right,
you can't assure consistency of results. And with hair, it takes a long time for it to grow out, like 10, 12 months. So you don't want to have a series of cases that you do, and then you find out in a year that like, hey, it just didn't look too good. So I think having those techs that are super good and consistent is very important. So yeah, so he has many cases running at one time. There's a big space there, so he'll have like 4 or 5 hair transplants at once. At the same time, he has, consultations that he's seeing in post-op, so he kind of bounces back and forth. He's got like his surgical area and then kind of just the regular exam room side, lots of staff, and he has one full-time partner in his office there too.
Is he a surgeon?
He's a surgeon, yeah, facial plastics, and then he was very comfortable with hair right after his fellowship.
And is his partner a surgeon as well?
Yes, who does
ENT also?
ENT, yeah, facial plastics, but does a ton of rhinoplasty.
Okay.
Doesn't do as much hair, but also because Dr. Epstein's doing kind of all the hair.
Right.
But just
do they do a lot of fillers and stuff too? They do like Botox.
His partner does injectables, but Dr. Epstein really so he does a lot of hair transplants, and I'll kind of go into the different types that we do. But also he does a lot of hairline lowering surgery. So it's a real surgical procedure. If someone, mainly it's for women with stable hairlines, because in guys, that hairline recedes, and if you make a big cut at the hairline and then their hair recedes, they're going to have this like ugly scar. Right. So it's mainly for women with stable hairlines who have kind of those high foreheads and they just want to get it smaller. You can do a transplant procedure, but you just need so many grafts, and usually over 2 sessions that, like a year apart. And not only does it get more expensive, but the results really aren't as impressive as if you like literally in an hour and a half lower their hairline and secure it in place. Yes, there's a scar, but then what we do is we transplant into the scar, and we do kind of like a rounding out procedure about 4 months after the surgery. So it's just a great combination for people looking to kind of get a shorter forehead. But we do eyebrow transplants, eyelash transplants for eyelash for the right candidate. I mean, it's not typically done for just building up the overall number of lashes if you already have a normal supply, because it's a surgery. I mean, there are some downsides to doing that, also especially because the eyelashes can grow in different directions. But it's for a lot of for burn victims, cancer patients, people who've maybe have like trichotillomania, who have gotten that under control, who are used to kind of plucking those hairs out. Eyebrow transplants, on the other hand, are very commonly done just for patients who are looking to get fuller eyebrows. They maybe have been plucking for years. And
where do you harvest those hairs from?
From the back of the head.
So those are long. Those could grow really long.
They grow, exactly. They grow long. They need to be trimmed, every few days usually. Yeah. So it just depends on the individual. But yeah, there's definitely some care that goes into that. But what's nice is that you get that kind of 3-dimensional natural look. And with our techniques, we're able to put many, many grafts into the eyebrow. So I can tell you that our sort of biggest competitor in New York City does approximately 100 grafts per eyebrow for case. We'll do about 350. So, wow. But again, it all comes down to the techniques to making those recipient sites that will take the hairs, and then being able to put each hair in, because you can get something called popping, where you start overloading one area, and then the hairs that you've already placed start popping out. So you need proper techniques to be able to really lay them all so that they line up. Yeah. So it's definitely a pretty cool thing. And then also we do a lot of body harvesting. So if someone wants more hair on their head, but they kind of ran out, I mean, you can run out of supply if you've had several hair transplant procedures. So we'll take sometimes from the chest, from the back.
Really?
Yeah. So other sites. And so it's that's pretty cool too.
It's funny. There's this joke where a lot of guys who don't have hair on their head have tons of hair on their bodies, and there's this law of hair conservation. You only have so much hair on your body, so it's either on your head or your hair, or it's either on your head or your body.
Yeah,
I never knew you could actually harvest someone's back. You can harvest their back hair and put it on their head.
Yeah, you can. I mean, usually they're a little bit finer. Sometimes they're more coarse actually than the hair on the head, but just depends on the individual. Usually it's a little finer. We don't like arm and leg hair because it's too fine. I think there's only one person out in California who does that. And then so to create density, you need to harvest thousands and thousands of grafts, which can get super expensive and, may still not give you the result that we're kind of hoping for. So we try to avoid arms and legs. We have a few patients who we've actually done transplants into their arms and legs because they've had like laser hair removal, like for guys, for example, and then they've regretted it for different reasons. But sometimes people want.
So you get those hairs from the head and put them in the arm?
Exactly right. Yeah.
Wow.
So our number one sort of donor site, like where we get the hairs from, is the back of the head. So the second place would be like the sides of the head, and third favorite would be the neck, actually, but mainly for guys. So that those are all good places to get hairs, and it's all can be safely done. But again, it's really important to have technicians who are used to that process, because it's a big team effort. There are usually at least like 3 people working on one person throughout the day, and these procedures take time. Like some people think, oh yeah, eyebrow transplant, I'll come in for an hour. Like no, like it's like a 6-7 hour ordeal. It's a very comfortable process. I mean, we'll usually give like a series of medications for swelling, for like antibiotic. We'll give oftentimes like a Valium and an Ambien, so you're really relaxed, a little bit sleepy, and then obviously like numbing shots. And people do extremely well. It's very well tolerated, but it is a long day.
So your protocol for like sort of the conscious-y sedation is an Ambien with Valium?
Yeah, Ambien, Valium. Usually we'll redose the Valium in the afternoon, but it's helpful to have the Ambien early, because especially if we're doing the harvesting from the back of the head, people are on their stomachs for like hours, and so it's just nice they can kind of like doze off and rest, and then they wake up, we're done with the harvesting, they can have lunch, and then they come back and we start planting, making recipient sites and planting.
Do you do all therapy in your office? I
don't. We have this kind of shared wellness space, so there is an old therapy machine that belongs to someone else. I don't use it.
I'm just curious, because it's a very painful procedure, but it's an amazing procedure.
Mm-hmm.
So we've been trying to figure out the best ways to get our patients through it. So originally we were using like Percocet and Valium. That didn't work very well. Then I just started using Ativan, which worked very well. But the interesting, might be interesting with the
might want to try the Ambien. I mean, for sure, like they need to kind of recover from that.
We always have someone take them home, or
exactly, because people can get really, really sleepy.
Yeah.
But I mean, we've done hairline advancements, and that's a very invasive procedure. I mean, literally we'll make that incision at the hairline, and then we'll go all the way down to the periosteum, which is that layer right on bone, and then go all the way back to the back of the head, and literally take their scalp and like pull it forward, and then we'll have to drill into the skull to put what's called endotines in that act to secure that scalp in its new position. So I mean, that's a lot of work, for someone to be kind of awake for, and that's all they get, Valium,
really,
and Ambien. So
and local, I guess.
And local,
right?
Yeah, lots of local. So if they can tolerate that, like for sure, I think they can do Ulthera and lots of other things. I mean, I'll do facelifts under something similar combination, and people do great. So I think, I mean, it's almost like you don't necessarily need deep sedation for a lot of procedures these days. And some people are, they're scared of anesthesia for good reason. I mean, your chance of getting a blood clot is higher. If they just take these pills, there's very little that can happen to them. So it's a great idea, and maybe it'll work for you guys too.
Okay. Always learning something.
Yeah.
So Gary, man, where can people find you? So just maybe some of your social and just your office information.
Yeah, absolutely. So Instagram, it's Dr. like Dr. Gary NYC. That's my main Instagram account. I manage that fully on my own. I don't let anyone touch that one. Yeah. And my website is City Facial Plastics. So I decided to name my practice like different from my own name, just in case it were to grow, and just kind of to have some umbrella organization. So it's cityfacialplastics.com. And if people have questions, they want to email me, the best way to do it is through info@cityfp.com. And then our number is right on the website, so they can just find it there. So
who calls anymore these days? Anyway?
Yeah, honestly, most people are like emailing, DMing online, finding me through like Real Self. I don't get a lot of ZocDoc activity because they're looking a lot of times for someone in network, and I don't do a lot of insurance work especially a lot of facial plastics, it's just not covered. Right. So I don't get a ton of traffic through there. But Real Self has been really helpful for my practice so far. For sure.
Yeah, well, I know you got to get back to the city to see some patients, man.
Yeah.
Thank you so much for coming out here, man.
Thank
this was
you so
great,
much,
and it was awesome learning about you and the stuff that you do, and you got like a lot of sophisticated, cool stuff going on. And I'll certainly be sending you some patients.
Thank you.
Hopefully, some of the other derms and plastics who don't do the things that you do, which I don't think there's very many people that do the things that you do. We'll send folks your way too, because you got a really bright future, man.
Yeah, I appreciate that. Thanks so much for having me. It's been great. Yeah, thank you.
Thank you for listening to the Dr. Mudgil podcast. The audio for this podcast can be found on Apple's iTunes and SoundCloud. Let's get it.